Hello friends, today is World Cerebral Palsy Day. More than just an awareness, it's an opportunity to celebrate and express pride in the lives and achievements of those with cerebral palsy and the people who are working and supporting them. Cerebral palsy is a disorder of movement, muscle tone or posture caused by damage to the immature or developing brain before, during or after delivery, and especially before 3 to 5 years of life. Brain damage can lead to issues like also sight, hearing and learning problems. The exact cause may not always be known, but it is mainly because of a brain injury or brain malformation that occurs during or after delivery. There are some associations which are known to cause cerebral palsy, especially infections in mothers with or pregnant women with a viral infection like chickenpox, measles, rubella, and also recently Zika virus are known to have children who can possibly develop cerebral palsy. Infants with infections like encephalitis or meningitis can go on to develop cerebral palsy. Severe untreated jaundice in neonates can again be a possible risk factor for cerebral palsy. During pregnancy and birth, like a complicated labor or complicated delivery, maybe a breech delivery, low birth weight babies below 2.5 kilograms, or premature babies, multiple pregnancies are always at risk to cause cerebral palsy. The first thing what I would advise you is look for any variations in muscle tone. That is, either if you feel your child is too stiff or rigid, or if the child is too floppy. If you feel that there is a lack of muscle coordination, like for example, if the child is finding it difficult in swallowing or sucking or feeding probably, or excessively drooling. If you feel that your child has low breathing movements of fingers or of the feet, or if you feel that your child has had delayed motor milestones when you compare your child with another child of a similar age, these are alarm bells which should ring, and you should be contacting your nearest pediatrician or your GP. Some other signs to look for are if you feel that your child is favoring one side of the body, like reaching out to objects with one hand all the time, or while crawling using a single leg, or preferring to lie down on a certain side. Speech delay, or also should be some other features which you should look for, including abnormal movements like maybe some tremors or seizure-like activities. Treatment is usually multicentric. There are varieties of non-drug treatments which can enhance your child's functional abilities, including physiotherapy, occupational therapy, speech and language therapy, and also recreational therapy. Drugs may be recommended in a few cases with extreme muscle stiffness, and also in some cases injections to a certain group of muscles to reduce spasticity. Surgeries are usually required if there are any deformities. Most cases of cerebral palsies cannot be prevented, but you can lessen the risks. In case you're pregnant, or if you're planning on a pregnancy, make sure that you have been vaccinated. All your vaccines are updated. Take care of your personal hygiene. Develop good habits. Seek early and continuous prenatal checkups. Also, practice good child safety. That is, try to install railings for beds to prevent injuries in children, especially toddlers. And if you're traveling with your child in a car, make sure the child is well seated in a perfect size car seat. And also, if your child has started using bicycles, make sure that he is wearing helmets to prevent any sort of head injuries. These are a few points which I would like to discuss with you on this day of cerebral palsy. Thank you for your patient listening.